Hi, Leilani. We haven't started yet. No worries. We'll be starting shortly.
Thank you. Thought it was my technology.
Was limiting some people from being able.
Hi, so Chanel, would you mind elevating Bruce? He couldn't find his panelist link. Thank you so much. Okay, Bruce, we've got you on.
Thank you.
All right, so I will start the meeting now. Can I get a second?
I'll second.
Thank you. So just to introduce the committee, I'll just start off quickly. I am Errol Miranda, Chair of the Housing and Human Services Committee. Pass it along to my fellow committee members.
I'm Angel Vasquez, also member of the committee, resident of the Washington Heights area in the southern end of Community 412.
My name is Aisha Oakley. I'm a member of the committee.
Hi, good evening, everyone. Assistant Chair of the Housing and Human Services Committee.
Bruce Robertson, Lower Washington Heights, member of the committee.
Thank you. So tonight we're going to be joined by representatives that have come forward. I want to thank the New York Presbyterian Hospital, who has also joined us tonight. I specifically put on our agenda that we're essentially having a discussion about its human services operations that are in relation to the COVID vaccinations, pretty much how they're working, specifically to inform the public about them, where they can go, specifically how maybe they might have already been making these plans prior in our community and how maybe they might be also even working to improve them at this time. So I just want to thank, again, Anna. This is the first time I'm meeting you. Julio, I thankfully have met before, but it's a real pleasure. And I'll also just note that we also are being joined by representatives that have come forward from the Department of Homeless Services, Leilani Urban, in addition to representatives from the Armory Foundation. We're joined by Glennis Aquino, in addition to as well Alberto. Sorry, is it Alberto or is it Albert? Because I heard someone say Albert earlier. I just want to make sure.
You can call me Alberto.
Okay, just want to make sure.
And actually, Ariel, I'm here as a CB12 member. Albert is representing the Armory Foundation. I'm here as a CB12 member.
Okay. So with that said, I want to open this up to Ana Garcia. Please, would you be able to tell us a little bit about just how things have been running with the New York Presbyterian Hospital's operations and perhaps maybe what we can learn from what's been happening so far?
Sure. So thank you all for letting me join you today. So I'm Ana Garcia. I'm the Director of Government and Community Affairs for New York Presbyterian. I know many of you have probably worked with Julio Batista, who is the director for the Columbia campus. I have the pleasure of working with all the hospital campuses. We have been really fortunate to work with the Armory Foundation. So Alberto, thank you for your partnership to establish a vaccination site. I think it opened January 14th, I want to say. The vaccination site was initially opened for people who are older than 65. And so at that time, we began partnering with the senior centers in Washington Heights and Inwood to establish a referral process so that they could sort of bypass the usual mechanisms that were required to get an appointment at the Armory, which entailed having a medical record in Connect and using the website. So we worked with many people I'm sure you're familiar with, like Fern Hertzberg and Isabella and other organizations that work with seniors in the community district to enable them to identify people who qualified for the vaccines and to work with us to get that referral. So overall, we've trained, I want to say 70 different organizations in becoming referral partners for us. The eligibility now for vaccines has extended to people who are older than 18 and have an underlying condition or a comorbidity. And so we are accepting referrals from our community partners for individuals to receive vaccines at the Armory. But then of course, people can, just use the website. In the last week, we have also opened a telephone hotline in partnership with Northern Manhattan Improvement Corporation. This is a hotline that's open only for people who live in Harlem, Washington Heights, Inwood, and southern parts of the Bronx. There's a screening process that determines eligibility to use the hotline. And so people now can also call us to make an appointment to receive the vaccine at the Armory. In total, at this point, I think we've vaccinated more than 50,000 people. And the process has been pretty good. We've been really pleased with how it's gone. We've had a lot of nice feedback from the community about the sort of customer service experience at the Armory. And a lot of our focus now is on trying to overcome concerns that different partners and different parts of the population have about receiving vaccines. We know many people still have questions about safety, and we are really happy to provide talks to community organizations of any size to help address concerns people have about the vaccine. So with that, maybe I can just see if you have questions or if there's anything else I could address.
Sure. I'll actually pass it along to Angel.
Mr. Chair, if you have any questions, go ahead. And are you good?
I mean, I have questions, but I want to make sure that I'm also, keeping everyone else in the loop here. Please feel free.
Okay, wonderful. So Anna, I want to go back to January when the Armory had an issue where suburbanites were coming into Washington Heights to get the vaccine and members of the local community were not being prioritized. Just looking to get some more background information on what was going on there. I was only able to catch the news clips, and so I think I just want to get more of what happened there and how was it eventually resolved. And then follow-up question to that is, of the 50,000 people that you all have already vaccinated, how many of those are actual local community residents?
Sure. So as you probably know, New York Presbyterian is a major academic medical center. So our patient population draws from the tri-state area. So when we let our patients know that vaccines were available at the Armory, we were letting people from a really broad geographic area know that they could come now to the Armory. And so what we've done subsequently is to prioritize people from certain zip codes to say that you have first access to the appointments so that we make sure we maintain at least 60% of our daily appointments for people from the designated zip codes. And you can see those zip codes now on our website, that's vaccinetogetherny.org. And it's a list of zip codes that's Community Board 9, 10, 11, sort of north to the Harlem River, and then it's like kind of an arc down across the South Bronx. And those are the priority zip codes. And since we implemented that prioritization, we do maintain actually closer to 70% of our daily appointments are people coming from those areas.
And on the question of the proportion of local residents of the 50,000 people that have been vaccinated?
I don't know that, but I know that ever since we implemented the prioritization, we've maintained it at a daily rate that it's more than 70% of the people. So like we're doing like 1,500 doses a day. So on a given day, 70% of those doses are going to local folks.
Okay. So just to be clear, government intervention was what led to having to change your strategy in terms of who was given access to the vaccine, right?
I'm not sure that is accurate. What do you mean by government intervention?
So my understanding is that at first you went to the broader, not clientele, but the patients that have been a part of your community, which included the tri-state area that was beyond just Washington Heights and Inwood. And it was until after news broke about the fact that folks that were from outside of the community were actually getting prioritized for the vaccination that things started to change. And so I just want to make clear, or I want to get clarification from you, if it was some sort of government intervention, either by the state or the city of New York, that caused that change to go from, let's go for everyone in the tri-state area that has been a patient at New York Presbyterian Hospital, to now we have to narrow it down to these particular zip codes in Washington Heights, Inwood, and Harlem.
No, I don't know that to be the case at all. I have not understood that the government told us we needed to make that change at all.
So then my question is, what triggered the change?
Oh, so we had been working with our community partners to keep an eye on sort of that level. And, you know, we were also observing who was coming into the Armory. We have a long-standing commitment to serve Washington Heights and Inwood, and had been doing phone calls all along to our patients that are living in Washington Heights and Inwood. So it was because of that relationship that we knew, for example, that we needed to develop a referral pathway with the senior centers. And it's just sort of happened in parallel to the observations that everybody was making, but we couldn't launch everything at the same time. But there was no government intervention. I'm not sure what you're referring to there.
Okay, I just wanted to get clarification as to what triggered the change.
Mm-hmm.
I'm good, thank you.
Thank you, Angel. So I'm seeing Isidro is next.
Thank you, Ariel, for your opportunity to address your committee. So quickly, Anna, great job by the hospital. And you kind of stole my thunder, but I wanted to check to see when you say that people that are over 18 and have underlying conditions, what are some of these prevalent conditions that you think some of our community members might qualify? Because that could be a broad range of issues and conditions that they might have, but they might not be aware that will qualify for.
Right.
And thank you, by the way, for everything that you're doing for the community.
Thank you. So the list of qualifying conditions was established by the state. So the state health department has listed on their website all the conditions that are allowed. It wasn't something that was set by New York Presbyterian. Something we did do is say that it had to be age 18 and above, because we're not staffed for pediatric immunizations like for people under 18. I think the state says people over 16 with underlying conditions now qualify, but our setup at the Armory is for adults only. The list of conditions is very long. It includes things like being immunocompromised, obesity, type 2 diabetes, neurological conditions. So actually many people in Washington Heights, Inwood, and in our priority zones will qualify, because many of these conditions are very prevalent in our community. So there is actually, because the list is so long, many adults actually do now qualify to get immunized.
And just a follow-up, if you don't mind, Nadia. Are there any link that will be both in Spanish and English that our folks can easily have access to? And have you done any outreach to make sure that residents are aware of this?
We have been doing, we have done, I'm looking at my notes, we've done 43 talks across New York City. So it wasn't just in Washington Heights Inwood, but with community organizations to let community-based groups know that the vaccine is safe, that they can get it at the Armory and at other locations in New York City, and to answer people's questions about the vaccine, because we know people have questions. So that's been a large part of our outreach. We've also been working with local media to place stories in local newspapers. I know the Manhattan Times has covered the work at the Armory on a couple occasions now. So we have been working to get the word out. And really, if any of you are interested in having our doctors come to your organization or come to your housing association or to your church, really any group of people that's interested in learning more about the vaccine, we are very happy to come speak. In terms of having information on the web, we do have information on the nyp.org website about COVID. We also have the vaccinenytogether.org website that is specifically about COVID and also is the place where people get information about the vaccination. And we also now have the hotline so people can call and make appointments with Northern Manhattan Improvement Corporation. So those are some of the efforts that we've had underway. But we are very open to doing more talks, doing more interviews, doing more outreach. Very happy to do that. Maybe I could put the website in the chat. And I will also put the phone number here.
Thank you. And I'll go to Liz.
Thank you. As a person under the age of 65 with diabetes, I just want to thank you for the extremely well run operation that you have and the thoroughness with which you make sure that the people who are I had to show a couple forms of ID to establish my address before you were I was able to book the appointment. I also really appreciate that you have, I know you need an appointment, but the addition of walk-in scheduling. So for people who are having difficulty reaching you by phone or by email, who can just walk in and schedule an appointment for, sometimes as early as the next day or even later that day, has been excellent. There's been a little bit of confusion about that. Some people have gone to the site to make an appointment and have been turned away, and other people have been, welcomed to make an appointment. So if you could just make sure that people are consistent about how that rolls out, and possibly figure out if there's a way for like caretakers to do walk-in scheduling for people who qualify, but for whom walking into the Armory to schedule an appointment is not necessarily convenient. So like I had to schedule my own appointment, which is fine, I'm ambulatory. But if I were taking care of, my grandmother, I would have to drag her with me. That's a little difficult. But in general, your operation was really smooth. It was really quick. The only reason why it took as long as I took is I bumped into a lot of friends, which was nice. And I really appreciate that you have somebody in the waiting area scheduling people for their follow-up appointment so that people leave with their appointment. That's key. So you had a really bumpy rollout to Angel's line of questioning earlier, and that was lamentable. But you clearly have done a good job moving forward in a much better way. So I appreciate that.
Thank you.
Thanks, Liz. Aisha?
Sorry, my mouse wouldn't pick up. So thank you for participating in our meeting and answering these questions. My question is in relation to the partnership between the Fort Washington Armory, DHS, and this vaccine program, what is the structure for how is the vaccine program paying rent, and who is the entity that you partnered with to have this program at the Armory? The second half of this meeting is about the governance of that exact building, so I'm just curious. Is there funding that allows for the vaccine program to be run there? What is that funding being used for? Is there rent or some type of licensing that is an aspect of that?
Really no license. I mean, so New York Presbyterian is renting space Armory Foundation. We're using it as event space, just as we would, time if there's another large event we might go there. And so they have kindly allowed us to do that.
I'm sorry, is she breaking up for only me, or?
No, I couldn't hear it well either.
Yeah.
Aisha, I think you're also having some bad feedback. Can you go on mute? Maybe that might be it.
Or I'll do that.
Can you hear me?
Yep.
So we rent space from the Armory Foundation, just as we would, if we needed space for a large event anywhere. So that is the sort of relationship. DHS is not involved. The entire partnership, though, of course, is a governmental relationship between New York Presbyterian and the state, where we're receiving vaccines from the state. Does that answer the question?
Absolutely. Would we be able to get information about that? The funding, the event rental from New York Presbyterian, if possible?
I don't know. I have to find out. I don't know if we normally share rental agreement information.
Okay. Thank you.
Thanks, Aisha. So I'll actually just try and ask a few questions here. So first, I'll just say I am very happy to know that I was able to get my father signed up and get a vaccine, thankfully, with NYP. The website that's been being utilized, I realized that this was kind of just a common occurrence for a lot of people, but how was it being, I guess, created and structured? Who maybe might have participated in that process?
The website, the vaccinetogetherny.org, that was developed by our IT department as quickly as possible once we knew we were going to receive a shipment of vaccines.
Okay, and did you perhaps maybe speak to some of the senior serving organizations that you've now been partnering with beforehand, or?
No, not beforehand. And we knew that the site had shortcomings and that we would need to sort of be working with community partners. But I mean, it was just sort of, let's get this up and then let's at the same time work with community partners to try to fill in the gaps. In addition to having the website up, we had, I want to say, several thousand phone calls that we were making to our patient base, like the patients that are normally seen through the ambulatory care network that we know are located in Washington Heights and Inwood. So that's how those individuals who we know weren't going to be going to the website were hearing about the availability of vaccines. It was through our phone calls to those individuals. So that was happening at the same time that everything else was being stood up.
Mm-hmm. And in relation to the work that you've now been doing with these various organizations throughout the community, can I ask how that might look right now, and maybe perhaps how it might have looked before? Like what individual activities might be taking place with these organizations and in your attempts to try and reach the community?
So what we did was that we set up webinar trainings for groups of like 5 to 10 community-based organizations at a time to show them a special website, not the ones that is public. It's a separate private website that they could use to refer patients to us to receive vaccines. So we trained sets of CBOs. I think we did about 7 trainings. And at this point, we've got like 70 groups that have been trained. And we are in dialogue with them on a weekly basis, letting them know about appointment availability, changes in the state guidelines, if there's going to be some kind of closure or change at the Armory. We keep them informed about all those things so that they can be managing communications with their clients. The way it works with these community organizations is they give us the names and information about their clients. We set up an appointment. We give the CBO back that information. They reach out to their clients and try to support them in whatever needs they might have in getting to the Armory. And then if there are any issues, we follow up with them. We've offered all those organizations the opportunity to have a vaccine hesitancy training or presentation to their clients and to their staff. And then a subset of the CBOs are now also sort of directly scheduling through a new module that's been, it's an artificial intelligence module. It's kind of a chat setup where they can directly be scheduling. So we've sort of added some technological enhancements to that process.
That sounds very cool. And also just to ask, is there perhaps any, I guess, individual staff members from NYP that perhaps are working alongside some of the small businesses, maybe perhaps putting the flyers just at the entrances of the maybe small businesses here and there throughout the community?
Yes, so we have part of our challenge in investing in flyers and business cards has been that the situation continues to evolve in terms of like who's been eligible, and we don't want to be printing incorrect information. So we've really like on a daily basis been struggling with what can we print to give out to grocery stores and pharmacies and to have people like standing on the corners giving out. So we are hopeful that at this point, we actually have some like a message that we can print and like spend the money in actually printing these things and hand it out. We're hoping very soon, but this is actually a conversation I have on a daily basis with my colleagues. It's just been the challenge of how do we, print thousands of something when we know that next week the governor might add a different group that is eligible for the vaccine. And then all that information will be incorrect.
Okay. I think just in general, I mean, of course, and this can perhaps change as well for your organization, but even just giving out the contact information could be very helpful for a lot of the folks that are kind of going through this very difficult time. Because sometimes, even when things change, that also becomes very confusing for a lot of people, myself included. And so with that, I just want to ask one last question, because I know I'm holding up this line. From the NYP staff, has there been any sort of determination as to how many speak Spanish, and specifically what the focus should be on for hiring staff members that are going to be working throughout your various sites?
You mean aside from the Armory, or?
Well, yeah, pretty much at the Armory, any of the other sites that NYP is currently operating, that speak Spanish, that could be assisting folks when they're coming in to sign up, or perhaps even just get their vaccines and sign out the paperwork, things like that.
So the way we have staffed the Armory has been, because we're still a hospital that's trying to do its normal business. So like we're trying to take care of patients at the same time. Nevertheless, what we have had to do is like stand up this operation that needs to vaccinate 1,500 people a day. And it's a big operation. And we definitely, when in doing that call for volunteers and staff that were interested in spending time in that Armory, asked for people who spoke Spanish. And people like myself, who I speak Spanish, and Julio and others on our staff, we were sort of put to the front of the house as much as possible so that we could be the people that were navigating and greeting and helping people come into the Armory. I don't think there were, anybody who volunteered who said they spoke Spanish was definitely like immediately put there to work and support as much as possible. And then in addition, we had the usual language translation, which isn't as natural or as, great to use as having a person who speaks to you in Spanish. But certainly we tried to deploy as many people as possible who did speak Spanish in the whole Armory operation.
Okay. Yeah, and I just want to ask that, you know, that's just considered a bit more, just given the kind of observations that were being given, because it seemed in a lot of different articles that wasn't a you know, something that was going very well there. There was a lot of the individual patients, or perhaps individuals that want to be patients, that were looking for that sort of assistance that could not necessarily access it. Given, I don't know exactly the full extent, but I think that that's just something to be a bit more concerned of, because this community, as you know, many of us have already known it. It's like you cannot go down the street not having known anyone that doesn't speak Spanish at this point. So you know, I just want to thank you again for that. With that, I will stop my questions, and I believe Angel, you were next up, right?
Yep. Let me lower my hand. I have two questions. I have a follow-up on, again, the 50,000 that have been vaccinated. Is there any way that this community board or this committee can partner with New York Presbyterian so that we can get at least, maybe not weekly, that might be excessive, but some form of reporting that allows us to know who is being vaccinated in terms of the zip codes that they're coming from, and also racial demographics?
I mean, we're happy to come back again next month and report to you what we have. Yeah, happy to.
Yeah, no, but I mean like some form of regular reporting where we as a community board, as this committee on human services, do get to see that level of data. We just want to make sure that, you know, we are holding accountable the institutions that serve our community. And we want to make sure that that commitment is there, right? And the only way to make sure and ensure that the commitment is there is by being able to be provided access to the data that you all must be, you know, compiling, because if you're targeting specific zip codes, then you would be able to determine where the folks that are getting vaccinated are coming from.
I mean, I think we're happy to report to you, to come to this meeting and report out. We will happily do that. In terms of data sharing, that gets pretty complicated. So I'm not sure what I can commit to on that level, but we're very happy to continue to come to the meeting and share with you sort of aggregate percentages.
Yeah, sure. I mean, that I think that could work. In terms of data sharing, I mean, this is information that the governor presents anytime he gets on the screen. And he talks about how many people have been vaccinated, what percentage of Hispanics have been vaccinated versus white people versus Black Americans. And so that's public information and in some level of capacity. And so you all must be reporting that level of data to the state government with your contract or your agreement with the state government. So I just, you know, I implore again that some level of accountability should be held at the local level as the Committee of Human Services for us to know that the commitment is being met.
I mean, I hope, you know, the 70% figure, you know, so 70% of our daily vaccinations are coming from the zip codes that are stated on our website right now. So they're all there. And I can further tell you, I think it's that like 60% of that 70% are from Northern Manhattan. And we can continue to report on that. I'm happy to come back next month.
Yeah, I mean, again, it would be nice to have something in writing and in paper that shows us where the people are coming from, right?
Yeah. So I'm sorry, can I speak?
All right. Yeah. Well, let me actually have Liz go. She raised her hand first.
Hi, thanks. I just want to dovetail on what Angel was saying and to note that the paperwork that I filled out asked for, among other things, it asked for a bunch of personal information that it would not be even remotely appropriate to share, but it did ask for my zip code and it did ask for my ethnicity. And there were a bunch of options, including, you know, prefer not to say. So you are, and I'm saying this as a person with an undergraduate degree in quantitative methods. I understand how data are gathered and aggregated. And as a patient of that very service, I know exactly how you're collecting the data. So it is possible for you to generate, and it's actually pretty easy for you to generate a daily, a weekly, a monthly report that says today or this week or this month, we gave 1,500 vaccines, and here's the breakout by zip code, and here's the breakout by gender, and here's the clustered breakout by, you know, age. I mean, you know, within sort of some kind of useful bracket. You can do that, and you can do that pretty easily. So at the risk of overstepping my bounds, since I am not the chair of this committee, I, as a resident of this community and a member of this board, respectfully request that the hospital aggregate that data according to a couple of points and just give us, I don't know, weekly report, monthly report, in an email to the chair, to Ebenezer, to, you know, it's not that hard to do. And as Angel pointed out, the governor has been doing this daily for, you know, 300 and something days. So I think that the hospital has worked very, very hard to provide an incredible public service, and we are grateful for that. And rather than having, you know, for us to like grill you and finger wag you and say, are you doing enough for this community? It's pretty easy for you to say, here's what we're doing. And for us as a community to be able to say, great, this is qualitative, this is quality quantitative data that is meaningful. So I would encourage you to do that.
It adds an extra level of transparency that makes us all feel more confident in the work that's being done.
Thank you, Liz.
Take that back.
Hi. So
Yeah, go ahead, Aisha.
I think we kind of resolved where we stand, where at least I agree with what Liz is saying in regards to reporting. But I just wanted to say, like, we also need to be careful about purview. I definitely think we want to address the human services side of how that operation is being run, especially within the specific building, which is the Fort Washington Armory. But when we start getting into the details of the vaccine and the outcomes and that kind of stuff, that's kind of bordering on another committee's purview. So I just wanted to point that out. And so if Ana Garcia was going to come to report, she would probably be doing that in health and not in housing and human services.
That's actually why I suggested the chair. And when I said the chair, I didn't mean Ariel, I meant Eleazar, the chair of the community board. And then that goes out to the committees that it goes to. It should go to the chair of the board and the district manager.
Okay, so let's sorry, Aisha, let's continue if you had anything else.
I'm sorry, I missed what you just said.
I was just saying, sorry, let's just let Aisha just finish her thought if she had anything else.
Yeah, I'm done. That was pretty much my point.
Okay.
But I'm definitely interested in the logistics, especially whereas we had what seemed to be a disproportionate amount of people coming from outside of the community that aren't it doesn't serve our community, especially due to the ongoing nature of things in that facility even. That is definitely a concern of mine, and I'm glad that we have our eyes on it.
Yeah, absolutely. Well, thank you so much. Is there any other additional questions? I'm seeing, Liz, you still have the hand motion or no? Okay.
Sorry, I forgot to lower my hand.
I have one last question, actually. And it's in relation to the type of vaccine that's being delivered. Is it the Pfizer, the Moderna? Do you all have any future insight of delivering J&J? What's the vaccine that's being delivered?
So the Armory has been administering Pfizer and Moderna, and it changes depending on our supply. And then of course, if you get one dose, then we want to make sure your second dose is the same. So the setup varies just depending on those logistics. We do expect to be receiving the Johnson & Johnson vaccine. We're not administering it at the Armory currently.
Okay, thank you.
Okay. And just to be certain, Aisha, did you raise the hand sign or?
Sorry, I forgot to lower it.
No worries, technology. All right. Well, thank you all so much. Really do appreciate, again, having you here, Anna. And I hope Julio is having a great meeting as well in the other.
Actually, I'm headed now to the health committee meeting. So I'm going to go join you in the health committee meeting. And thank you for having me. I welcome all of you to please spread the word about the NIMIC hotline. And I guess I'll also email it to you, Ariel. Is that the best thing to do, or do you have it now?
Yeah, absolutely. Please feel free to email me. I apologize. This is definitely in the chat. I just know that once the chat closes, I don't get anything.
Okay.
So
That's
yeah.
fine. I will love you. So thank you, everyone.
Thank you. Take care. All right. So with that, I guess we can start our second portion of tonight's meeting, specifically dealing with the oversight of the Fort Washington Avenue Armory. I want to thank Leilani again so much for coming tonight. Really do appreciate it. In addition, we also have, again, Alberto Aquino, also representing the Fort Washington, the Armory Foundation. I always immediately start mixing the names. But yes, so I just wanted to tonight begin by focusing just on where the responsibilities lie within at least the charter for both ourselves as community board members, in addition to that of which is the Department of Homeless Services. I was speaking to Maria just about this because I thought that it was incredibly important just to understand how we can also better interact with just any agencies in general, kind of getting the understanding of what exactly is the common expectation, both of ourselves in addition to that of agencies. And so I just want to make sure that I share the screen with folks beforehand. So just give me one moment here.
Ariel, just really quickly, it looks like Glennis has her hand up. I'm not sure if she wants to share something quickly.
Oh, sorry. Sorry, did you have something to mention beforehand?
Yeah, thanks, Ariel, and thanks, Chanel. I just wanted to let the committee know and all of our guests, I am here as a CB12 member, but I am employed at the Armory Foundation. I've been there over 10 years. I'm in the management team. And I just wanted to join the conversation today about, what we're talking about, the oversight and the utilization of the Armory and all the programming we have going on there. Thank you.
Great. So just very quickly, I want to make sure that I'm also just providing this information other than my emails. So just a few things I wanted to note. What you'll see is section 2704. It essentially establishes duties of agencies, specifically agency officials, with respect to the evaluation of performance, the authority over programs, personnel, and facilities, as well as makes clear they must consult regularly with the borough boards. In addition, per section 2707, you also see that it will establish duties to prepare annually a statement of its service objectives, priorities, programs, and projected activities within each community district, if it is requested by the community board. In addition, it must also consult with the community board. for section 2708, it states that agencies must make available to each community board current information on its operations and programs. If you go to section 2800, it's a lot, but what you'll essentially read within it is that it states community boards are to request the attendance of agency representatives at meetings of the board, consult with agencies on the needs of that district. And in subdivision E, it will also make clear each agency shall furnish promptly to each community board on request any information or assistance necessary for the board's work, as well as report periodically to each board on its services, activities, programs, and operations within the district. I wanted to share that because I think that when we've had conversations in the past, there's kind of just been a lingering idea of what should be happening here. I always refer to this in my committee because I want to make sure that folks are also just aware of what our own responsibilities are, how we're supposed to be interacting with the agencies. I think that that's very important. I know that we come from many of us very different backgrounds. Being in government, this kind of gives a little bit more of an insight for folks who have not necessarily dealt as much with the charter. The reason I think that we're all just here tonight is because we're very concerned and passionate about the community services in our community. We've also had a conversation now going on for about 7 years. Some have said longer. I have not been here, of course, that long, but I have been hearing many concerns. I think that throughout these past 7 years, the reporting, the kind of highlights that we're seeing with regards to what is a draft or perhaps an example of the license that's been given to the Fort Washington, or sorry, the Army Foundation. I'm always going to keep doing this. That has kind of served as an example for why we might have concerns about how space is being utilized. I know that back in 2014, we were presented with articles that were essentially consisting of many members in our community expressing their concern about there not necessarily being space made available to them. Some individuals had expressed that they did want to review how much could be being charged if ever there was anyone trying to request space or perhaps services. And so that is partly the reason why we're here tonight. I think that many have already expressed that they have not necessarily felt that those kind of concerns have been brought up or necessarily addressed. And I know that we have, again, and I've said this to the committee, Leilani, you are an incredible person. I think that we've already had like the experiences before of working together in communities and also seeing exactly what you do, what you bring. So I, of course, just want to make sure that I, give, of course, that opportunity to you to also speak to the community board about what your role is, what perhaps DHS might be doing with the space, in addition to those members who are also within the Armory on a regular basis. So with that, I would like to just pass it along now to Leilani, so as to try and give us a little bit of a background as to what exactly happens in the day-to-day there.
Hi, good evening, everyone. Thank you all for inviting me to come back to Community Board 12. Ariel, it's good to see you again. It's been, I think, 3 years since we last worked with each other in pre-K. So it's good to see you. In this capacity that I serve and work with the Department of Social Services, you can just think of me essentially as a liaison, like as a vessel between community stakeholders, elected officials, community boards, and the agency, Department of Social Services. I cover community boards 1 through 12, the entire borough, and deal with an array of everything under the umbrella of Department of Social Services, from street homeless activity throughout the borough. I do the shelter notifications, and I make the announcements whenever there's a new shelter come into community, whenever there's incidents in community involving clients inside a shelter or on the street. those get escalated to me, and I help triage and try to help resolve and quell any issues or concerns in community as it relates to homeless services. That's just not really even scratching the surface of all the things. But if I could give you a quick snapshot of the work, that's what I do. And so whenever there's any concerns involving the agency or questions regarding like today's conversation and discussion about governance, the Department of Social Services is they would send me out to respond to those concerns and those matters. As it relates to the Armory, I'm limited on what, there's been a lot of back and forth about this, as you expressed, Ariel, for years. It even predates me in this position. I got involved with the Fort Washington Armory governance piece, I believe back in late 2018, 2019, after a former operator, nonprofit organization, GDES, was removed. And that is kind of when DHS got roped into this discussion and the conversation about governance. At this moment, I'm here as in a listening capacity to see what questions, concerns you all have regarding like what specifically what are questions you'd like the agency to answer. I know in the past, working with the former chair of CB12, we were sent literally a list of, I think, questions of about almost 500 questions. We answered them. Last year, 2020 feels like a year that we actually paused throughout 2020. So just scrap 2020. And going back to 2019, when I last came to your community board to discuss the governance of Fort Washington Armory. I see Gary hi Gary. You're right, it was 2018 when we met and this conversation started. So back in 2018, going into 2019, it was brought up, some community concerns were brought up to the agency about utilization, who has access to the Armory, who doesn't. And we had series of conversations that involved the Armory, Congressman Espaillat, the elected officials in the community board, where we were talking about how, what services the Armory offers. So just for full transparency, the Department of Homeless Services operates and utilizes a shelter within the Armory, and that's operated and managed and ran by a nonprofit organization called Project Renewal. They also sit on Community Board 12's District Service Cabinet meetings every month. So there is representation from me, and there's representation from the shelter operator that operates the shelter in the Armory every month with Community Board 12. And that is where we share updates, agency updates, and that is where we look for feedback of concerns. Tonight, I'm not quite, I don't know what specific questions you all have for me or the agency, but would like to take the opportunity to just pause and get feedback from you all on what specific questions or concerns you all have. The District Service Cabinet meetings are usually spaces where we would take and field those types of concerns or questions growing in community, or the agency burning questions. So I haven't really received any new incoming or new concerns. I also can't speak too much about the governance piece. Last conversation where we left off with the Armory and the community board was that we would work with the Fort Washington Armory, have some conversations and discussions about the governance piece. That's somewhat paused due to the pandemic. And so our legal team, and I believe the Armory and DHS are all in close communication, working and ironing out those specific details, but I'm not able to speak to that in depth, but I'm here in the listening capacity and here to take notes and, circle back to you all with specific hardcore updates on your specific questions and concerns. if that makes sense.
Absolutely. Thank you, Leilani. So first off, I'll go ahead and pass this along to Aisha.
So, hello, Leilani. So previously, when I was chairing the Housing and Human Services Committee, Leilani Irvin, as well as Matt Borden, which it seems he's no longer with DHS. Is that correct?
Correct.
Okay. Yeah, I've noticed that today on Green Book, that his position seems vacant. Is someone going to be replacing him?
Have no details about that, but standing in as of now is Assistant Commissioner Erin Drinkwater.
Okay. So in regards to the questions, you referenced our previous chair, Richard Lewis, may he rest in peace, had presented the agency with 500 questions. I remember a large amount of questions. I don't think it was 500, but I know for certain that that was for a completely different matter that was specific to shelters in the community and the specific shelter that we were reviewing at that time. However, this committee, when I was chairing it, sent you a specific number of 23 questions.
Yeah, we responded.
Which were presented before the meeting that DHS appeared at. The borough president had to insist that DHS show up to the meeting because the agency was not cooperating at first. And then when you showed up, you still did not have the answers to the questions that had been asked in the previous meeting by email. And then we reiterated them in committee, and we had to put forward a resolution insisting that the agency comply according to the spirit of the charter, very much to the tune of what Ariel read some of today, that you cooperate with our organization. So I am baffled by this idea that you're here to take notes now. There's been more than enough information fielded to the agency in regards to the questions that we have about the governance of this building. And in fact, because in the absence of that, many of us have had to dedicate our time, myself specifically, and members of GDS and other community members, in order to gather the information that the agency was not complying with. And we still have questions that are outstanding. Much like what Ariel mentioned, which is that the agency has a responsibility where, and I remember this video of me asking these specific questions, which is, what are the outcomes that we're seeing from that building? What is the usage? What is the usage for specific spaces within the building? What does the license allow to be happening there?
Yeah.
And we had a meeting, we had multiple meetings this year around this issue.
Yeah.
4-page resolution that was generated out of this committee based on the totality of that work then and now. And at the midnight hour, the agency contacts the current chair of Housing and Human Services to say, oh, when we want to show up and answer questions, and you come to say that you're here to take notes, you don't have answers.
I don't.
Yeah.
And I apologize for that.
This is the spirit that we have continued to experience from the agency. It is unacceptable. Leilani, we've had conversations. I don't think that this falls in your lap, to be perfectly honest.
Yeah, I want to.
It's a disrespect to our board continuously.
Well, I would like to take the opportunity.
Held up. I was furious last month because this resolution should have went to the general meeting, and instead it was held to allow for the agency to appear to answer the questions that you're here to take notes about.
Yeah, may I speak? Thank you for that. We have been in a lengthy dialogue, especially with you, Miss Aisha, in the past about this governance piece. We have come before the board for 2 proposals, one for the shelter that was proposed for men that got flipped to women. And in those series of questions combined were questions about Fort Washington Armory. And as I understand it, I do believe we did answer those 23 questions, but I can circle back to confirm. I've spoke with Ebenezer to also see if we can pull back those documents that was sent back to the community board, our responses. Matt Borden and myself did come before Community Board 12 to discuss this with the board. I unfortunately do not have any new agency updates. I expressed that to the chair a few months back and would have preferred to come back and before this committee with answers to the questions that was submitted. There's, at this moment, unfortunately, I don't have those answers, which is why I would request and make the recommendation to, if there's additional questions or specific questions you want the agency to answer, please send those in to me. And we would have an obligation and a duty, obviously, to come back and present, those answers to those questions. I, at this moment in time, do not have that. I also did not receive any questions prior to my arrival to this meeting as to what I'm expected to answer, and try to have conversations to discuss prior to my arrival or commitment to attend this meeting, because I did not want to give this impression of what is all, or the frustration of the backlash that the agency showing up with no answers and no response. I don't know what was coming to, I don't know what specific questions folks was expecting me to be prepared to answer. So what would be helpful for me is to receive those questions in writing. I'll put my information, you all have my information so that I can be better prepared to come back and answer whatever questions or concerns that you all have. As I understand it, it was my understanding that responses were drafted and sent. And I spoke with Ebenezer. He's also recalled, he said he would also try to pull those old emails, and I will as well. But I decided to show up today because we're not hiding from anyone. And I know it's just frustrating to not have the answers, but I thought it would be appropriate to show, I would have preferred to show up with answers, but I also thought it would be, one, I want to make sure that this impression that I'm getting is that that folks think that we're hiding or trying to avoid the community, and that's not at all the case. So I showed up, I'm here to listen, and I'm here to field and take back any questions that you all have that you would like answered back to the agency to ensure that those questions get addressed. I'm here in that capacity. I'm open, and I totally hear you, and your frustration is valid, but it would help me be prepared next time to show up, to be more responsive directly to your specific questions that you all have. And I want to just take the opportunity to get those specific questions. What is it that you want the agency to?
Unfortunately, after I issued those 23 questions, I was targeted in my position, and I was actually told the previous chair insisted that I stand down off of the Armory matter, or else. And the or else ended up being me being removed from 3 leadership positions after being on this board for many years and dedicating my time. So, but what I also know is that 7 hours ago, GDS, the organization which was in the building that I also feel was removed due to retaliation, sent those 23 questions to you. I just saw your name on the copy. So you should.
Yeah, they also, yes, they also sent it via Twitter. My personal information was put out there. Yeah, folks know who we are. They know how to get to us. That's not a question. That we definitely received. I'm sorry if I gave the impression that I said we didn't receive those questions. We received those questions. My understanding is that those questions were answered by our legal department.
So you didn't come, you don't have the answers with you now. Do you have them on your computer? No.
So what I would like to take the opportunity to have is for folks to ask me specific questions as to what new concerns or burning pressing concerns are regarding the Fort Washington Armory.
Okay.
I think that would be helpful to start there.
So I have the 23 questions in front of me right now, but I'm going to defer to the chair as far as what he would like to see happen here.
I do want to see, of course, the responses. Leilani, if those are perhaps still within DHS's, own data banks, I would like to request that they are sent to us.
Sure, sure.
Specifically just myself, and as well Mariel.
Expeditiously also, because we do have a general meeting, which I hope we're going to be reviewing that resolution again.
Yeah, and so I would like to request it within a week's time, if it's fair to say by the 11th. And let me just perhaps just give some time to Angel. I know you've had your hand raised.
And unmute. Great. Nice to meet you, Alani. So I do have a series of questions. If you have answers to them, great. If not, jot those down and maybe
Sure.
that's how we continue the conversation. Do you know when was the last time that the Department of Homeless Services signed a renewal agreement with the Armory Foundation?
No.
Okay. And do you know what is stipulated as the primary purpose of the Armory Foundation's agreement with the Department of Homeless Services to operate in the building?
I don't have any of that information to share with me tonight. That would be legal.
Okay.
Meaning the legal department would have full oversight specifically to those types of questions. But those are answers those are questions that we can definitely answer. So.
Okay, just because I want to state that we did manage to get a hold of the legal agreement between DHS and the Armory Foundation that dates back to 2002. The agreement does explicitly stipulate that the agreement is in effect for 5 years. Obviously, there's a lot of different caveats as to why the agreement could be terminated, but that every 5 years there's an opportunity for renewal. So under the assumption that maybe there is a renewal every 5 years, that last renewal would have happened in 2017 is at least my understanding. I could be totally incorrect. There could have been some mishaps in between, but 2017 is in my mind what I'm thinking at. In the 2002 agreement, though, it says in page 1, pursuant to a license entered into on August 1st, 1995, licensee enter upon the premise to establish and operate a New York City high school track center on the 3rd or drill floor of the building with adjunct facilities on the 2nd and 1st floors for use primarily by New York City high schools and other groups solely for the purpose of track and field competition and practice related athletic activities, all in accordance with an applicable provision of state, federal, and local law. The reason why I want to read that out loud is because there is a provision in there that says primarily for New York City high school students for the purposes of track and field. What we have seen, and I live right around the Armory, are not New York City students. We do not see New York City high school students participating there. It is crumbs when they do. It is one weekend when an elected official would like to host an event. I have been a chief of staff to an elected official that has hosted an event there, and it's once a year, and it's as if it's a charity case, which is not okay, given that the original agreement says for New York City high school students. I have also sat down with the leadership, this is in my previous position, with the leadership of the Armory Foundation and asked, what relationships have you built with the local high school in the neighborhood, George Washington High School? I was told, now I'm speaking for me, right, not for this board. I was told we have attempted programming with George Washington High School. Unfortunately, we try and the students don't show up. Now, do we put the onus on high school students that range from the age of 13 to 18 years of age to show up, knowing also the background of these students? Or do we put the onus on the organization and the institution that is renting from a city agency to do the outreach and the proper outreach to ensure that those students are actively participating and making use of what is city property and city land? So I definitely just want to get back the answer as to when was the last agreement signed. And I would also like an answer to what is the primary purpose of the agreement of why the Armory Foundation exists inside of a public building owned by a city agency.
I just want to point out that in a previous meeting that I chaired, we asked
Aisha,
that question to
Aisha.
Rick Fidel. Sorry.
Sorry, let's just, sorry. All right, Glennis.
Thanks, Ariel. So I just wanted to clarify that George Washington High School actually trains at the Armory prior to COVID. The school has been coming to the Armory facility since that meeting that we had, Angel, I believe 4 years ago or so. They've come to the Armory after a lot of hard work on our part to reach out to them and get a coach for them and work with them. They've been actively participating at the Armory since then. And we have over 20 meets throughout the year when we have a track season. Obviously, that's all suspended now with the vaccine program, that are just dedicated to DOE local schools. And that goes for, and that's not including, sorry, our local program for City Track Little Feet and middle school students that is strictly dedicated to students from Washington Heights, Inwood, and Harlem. And it's all at no cost. Thank you.
Mr. Chair, can I answer considering it was directed at,
Sure.
directed towards me?
But I just
Go
want
ahead.
to clarify, Glennis, when you say we and our, I just want to confirm, who are you referring to? Because if you're speaking on behalf of the organization, you're not speaking as a community board member.
Well, I'm a community board member that works at the Armory. So the Armory Foundation. So I'll clarify and say the Armory Foundation. I just have, over 10 years knowledge about the organization. So I bring, something of value to the conversation. And I want to make sure that whatever we're discussing and putting out to the public and to the committee members is accurate. And, between myself and Mr. Aquino, we are probably the best source of information that you can have. So if you have any questions about our programming that is specifically for the neighborhood, the amount of children that we have coming in, Mr. Aquino is the director of youth programming. He's built a program from the ground up that is specifically for the neighborhood. Please, we are happy to answer any questions that you have.
Okay, thank you. And I'm so sorry. Angel, I want to give you back the opportunity.
Yeah, so I guess my follow-up question to the number of meets that are dedicated to DOE schools is, what is the total number of meets that occur at the Armory on a yearly basis?
I'd have to get back to you on that. I don't have the number off the top of my head and I don't want to give you misinformation, but
Yeah,
I can
absolutely.
give you a breakdown of the schools. I can give you a breakdown of where they come from. All of that information is readily available.
Yeah, so that would be fantastic to be able to get that level of information. Again, on an accountability, similar to the conversation we just had with New York Presbyterian Hospital, just on a simple basis of accountability, we need to know how many DOE schools are actually being serviced on a yearly basis at the Armory, if the primary purpose is to serve as a track and field space for students of New York City, for New York City high school students. So, 20 meets for DOE schools could be a lot, could also be a little. It all depends on what that denominator looks like.
Sure, I'm happy to get that information, and you're absolutely right, Angel, that the data helps back up and keep us transparent about all of the work that we do. And we're happy to provide data as well on top of that about all of the work we do with the local schools as well, just so you have a very clear picture about the footprint that we have in the community.
Yeah, I think that would be fantastic to just add that level of transparency.
We'll make sure to get that to you within the week.
Thank
and
you.
Angel, please, I don't know if you'll at the end want to send your questions to Ariel, and then Ariel can send it to me, but if you can just send me your specific questions that you asked. I wrote them down, but if there's any questions additional to what you just expressed tonight, please send them to me or to Ariel, and I'll give you my email now.
Thank you.
I'm so sorry. I also, sorry about that. Yeah, I just want to also try and continue going down the line here. I believe Gabriela was next.
Thank you very much. Thank you, Ariel, and the members of the Committee of the Housing and Human Services. And thank you, Leilani, for coming over. And I perfectly understand that this is kind of not too well prepared, right? meeting for you. But I am speaking right now, not only as a board member, but also as a community member. And I was really involved, I would say, when GDS was evicted from the Armory. And I can tell you, as a former elected official as well, you know, and when I say we, I'm talking about, you know, a whole bunch of, you know, community people. We really outreach and knock on doors on pretty much all the elected officials. And as far as I remember, all elected officials wrote letters in support of keeping GDS in that space, which is not too common to get, you know, because not always elected officials, you know, agree on something. But in this particular issue, they agreed. And I can tell you on all different levels of government, there were letters of support for GDS. And I really don't understand what was the issue? What was the problem? Why, you know, a community-based organization that so much needed for our youth was not kept in that space. You know, I don't really understand what was the logic, and quite frankly, back then we didn't have any answers. You know, I remember that we tried to make meetings and to try to call in all the interested parties, and quite honestly, DHS and social services, you know, they were not present, right? I probably before you came over or at your early, when you early got in the position, I'm not sure. I'm just speaking as a community member more than anything else. And I can tell you that organizations like GDS are so much needed in this community. And this is regardless of personalities. I love Dr. Gary and I respect his work. He might probably have his own style, and some people might probably not feel comfortable, but you know, our community, our youth is well above that. This is not about personalities. This is about, you know, a work that is really needed. We are, you know, our youth needs that type of program. So I'm just going to finish by saying that I am not too much, you know, in the conflict, if there's any, with the Armory Foundation or anything else. I'm just focused in this particular organization that was really very arbitrarily removed from a space so much needed. Thank you so much.
Thank you, Gabriela. So I just want to also, I think Alberto was next, and then I can't remember, I'm so sorry. It was Aisha or Domingo. Please let me know between the two of you. Okay, Aisha. But yes, Alberto.
I just wanted to go over some of the points that have been stated.
Aisha, I'm just sorry. I was saying Alberto and then.
Okay. Oh, sorry. No problem.
Yeah. Well, I just wanted to say hello to everybody. I've been working at the Armory for about 5 years now. I was hired to run our youth programs. Well, initially I just started a small middle school program, but I wanted to say hello, everybody. Just give you a little background about the role that I have. I currently am running over 5 youth programs in the building. And I specifically just the Angel's comment about just the community and who we're serving. I was previously going to community board, general board meetings every month whenever possible to give this information. We are doing our very best to get this information out there to everybody because there seems to be a lot of confusion, but I have a lot of information about it. We have an incredible amount of support from schools, from the superintendent's office, getting the kids in the building. So just to start, we have regularly every Tuesday and Thursday during the track season, hundreds of kids who are high schoolers in New York City on the track. Every Monday, Wednesday, we have hundreds of kids who are specifically and exclusively from Northern Manhattan who are in the building running track. So that is for a massive chunk of the year. So Angel, I'm sorry that you're not seeing that part of what we're doing. Last time that I spoke to this committee specifically, we did open the door and we said, hey, if you'd like to come in and have an opportunity to see some of the programs that we're doing, we would love to welcome you and show you what it actually looks like, how it's running. Obviously right now with COVID, things are a bit different. But however, I'm always happy to talk and specifically share with you like, hey, we have these schools that we're working with. Hey, we're really interested in this school, but we might need some help. Right now we have dozens of middle schools who are sending us their kids. That includes parochial schools, that includes charter schools. I just had an hour conversation with representatives of School at the Square. So Angel, I love that you really want to get the kids in the building from the neighborhood. We want the same thing as well. I think that we've been pretty successful given where we started because it hasn't always been a tremendous amount of kids. And what's one of the things that is my top priority at the Armory. But I'm here also like Liliani, and we're here to listen to the questions and hopefully we can answer as much as possible.
Thank you, Alberto. And Aisha, I'll pass it to you now.
So I just wanted to double back over a couple of points that have been made. Being the board member that is most intimately acquainted with this, having been the person who first introduced the original resolution in 2014 about the matter when Alize Beal from the mayor's office sat beside me on the Youth and Education Committee and said she had visited the building, she did her own review, and she did her own review from within the mayor's office and could not get any answers. She did not have a copy of the license, did not know what the governance of the building was, and didn't feel satisfied with the outcomes she felt being produced. And I want to be clear that when we're saying this, because what happens in this conversation is people say, what do you mean? The Armory Foundation runs a wonderful program. That is not of issue here. This is not about the need for the Armory Foundation to come and put a public relations front forward and explain what it is that they're doing. This is specifically about the overall building, which is a 2-acre building, and how it breaks down to serve our community most effectively, right? And the license delineates how that is supposed to function. And in fact, how it is functioning now, though it may have improved in the last 4 years, and yes, Glennis was completely correct to say in the last 4 years. I have been a part of some of those meetings that were the genesis of some of that work due to the pressure that I specifically, before I became a chair on this board, put forward to insist that our children be served. But yet 2 years ago, Rita Finkel came to our meeting and said, what do you want me to do? I can't get your kids in the building. There's video that exists of that statement. Despite the fact that the top 5 people, I sat at the small business library on 34th Street and pulled the 990s. The top 5 people on certain years were being paid close to $1 million. So if you're making roughly $200,000 a year and you can't get our kids in the building, that seems to be a problem to me. I agree with Angel. I've taken pictures of the school buses from out of town that take up the parking spaces in our neighborhood when they come to use the facility. It has changed over the years. The genesis of that is the pressure that has come from this conversation that started in 2014. That being said, this board passed a resolution to keep GDS in the building, and that also was a big part of the elected officials also coming and community members writing letters in support of GDS. So I want to just put that on the record in this meeting. Also, of issue, like I said, is not whether the Armory Foundation runs a productive program. It is, do they have a right to run the building in the ways in which the building is being run? Do they have a right to all the floors on that building? According to the license, no. According to the license, they're supposed to run a very specific type of program, as Angel has spoken to in this meeting, right? And whether that program fits into that bracket or not is really not my gripe. But if we were looking at the license and saying, these are the rules, are they following those rules? That's the question that's open, right? However, we had a catering company, and we have the chair of the licensing committee here. Thank you, Isidro, for coming and taking part in the housing meeting. The chair of the licensing committee is here. We had a catering company that is a partner with the Armory Foundation or their contractor attempt to request a full liquor license to be able to serve liquor at the Armory. How? When the DHS is supposed to be the front as far as who is in charge of that building and what happens in that building. Armory Foundation should not even be requesting a liquor license, but according to that same contractor, and we have that on tape as well, where the contractor felt like they were thrown into the fire because they said the Armory Foundation sent them to our meeting to request a full liquor license in a building that is supposed to be mostly serving youth. This is the type of thing that's happening there. We also had a man living in a makeshift apartment inside the community building, while community organizations are being denied access to that building. We're talking about 2 decades of time. Some of the questions that have been put before the agency are, for instance, please provide information about the licenses, space rentals, and unused space, as well as their durations over the last 10 years. I would assume that the agency, being who is supposed to be in charge of the outcomes in that building, that's data, that's very basic data that they should have. We have not gotten that list that I've seen. I don't know if Ebenezer might be producing it, but I've never heard of such a thing being produced. Right. Neither in the conversations we've had with the Armory Foundation were we able to get that list either. But that list will speak to whether they're renting the building properly. Well, they're not supposed to be renting the building according to the license, right? The revenues that are coming in as of that, and in my opinion, this building is being used as a corporate Airbnb by the Armory Foundation, which is not supposed to be. We had earlier in the meeting, you heard me raise to Ana Garcia from New York Presbyterian the question of the funding for the vaccine program and who that money is being allocated to. Is there a partnership with DHS? And she unequivocally said, no, the partnership is with the Armory Foundation, as it always would be when they rent event space. They rent event space under the name Armory on the Hudson. It's listed in Crane's Business Magazine, for instance, and other magazines for the purpose of renting the space, which is in contrary to what the license allows for. Because the spirit of the license is so that there would be access for the broader organizations in our community and not just one. And the way in which the building has been run for years is not that.
So I'm gonna just ask to pause.
I'm done.
Because I just want to be respectful of everyone's time and just give everyone the opportunity to participate. Mariel, would you please start a timer for when we start, folks, just so we can try and make sure we're putting questions out?
Yep, certainly.
Okay, thank you so much. Isidro, would you please let us know your thoughts?
Thank you so much, Ariel, once again. I agree with what Aisha has brought to the table. Also for bringing clarity. I was not fully clear on what the questions are, but understanding that we need to know what are specific aspects that the Armory should be running and which areas they should be occupying. Now I have more clarity. And thank you, Aisha. I think you have done an outstanding job in researching all these matters. We were caught a little bit surprised and off guard when they came for licensing. It was a completely unusual license, if I might say that. And off guard, obviously, when you have kids, you don't mess up with alcohol. So we questioned the judgment of the Armory back then as to why they came about to request a liquor license. Having said that, there have been many questions as to how the foundation has been running, the openness to our community. And I think Aisha is right, this is not a judgment about the foundation and the program, the many programs they offer to the community. Perhaps, maybe an effort can be made to do more outreach. I personally did some research, I think maybe 6 years ago, and there were many opportunities for the Armory to reach out to our community. And back then I noticed that there was a pure and decent administration there that tried to do the right thing. But every now and then when you try to do the right thing, doesn't necessarily mean that you're going to do go all out. So I support what Aisha has brought to the table. I will be in support of what this committee can produce as a resolution. And anything that I can do, I'll be there to support you. Thank you here so much for your assistance.
Thank you. And I'm so sorry. I just wanted to know, Domingo, I did not see your cursor. For some reason it went off, but please do go ahead.
Yeah, it happens. Yeah, and I want to because at the end of the day, these folks are workers. So Glennis, and thank you for the achievements that y'all been able to do in the short time that you have, or whatever time you have there. My only concern is that it seems pretty disrespectful when you have the Armory sending 2 of their employees and not necessarily somebody from their board to be able to speak on these matters, and I think it's important to note and to state on public record, you can't hide behind the fact that you're engaging youth of color now or youth from the community now. You can't hide that you send certain individuals that look like the community to speak on behalf or to speak up for the Armory. I think it's very important to note that we need board members who are people who are leading this agenda of the Armory to also address our community, right? Because this disrespect from the Armory is nothing new. You have a president who stated the Armory happens to be in Washington Heights, but it doesn't belong to Washington Heights. So that's something that's very important to note, right? A leading figure of that institution speaking that sort of way. And I don't know if he was the president, he is the president. I don't know what happened with that whole situation, but I think it's important to challenge that mindset that when you use public space, right, and you fundraise and you do everything you have to do, that you own it. The space belongs to the public, and we need not only the outreach efforts that a coordinator is doing for you, for the community, but we need the racial breakdown of everybody to have using the Armory, right? We need to understand not only the 2 or the 3 days that the kids from the community get it, but what happens all the rest of the week. I think that's important data that needs to be shared. I think it's important to be important data that needs to be shared is their scheduling breakdown. You know what I'm saying? Because that's another situation. So if you from the community aren't necessarily taking full advantage of the space, who else is compensating for this? Who else is benefiting from this, right? And not to diminish the work that folks are doing. It's not about you. I think it's more about the structure that composes the Armory, right? And we need to start challenging this notion of public-private. It's a public space. So I can't go to my landlord and tell him, hey, look, guess what? This building is public. Now, this is the rules you got to abide by. It's private property for a reason, right? So I think with that same level of understanding, we have to also acknowledge that this is public land. How is this being able to advance public land? How is this fulfilling its contract? So back to Angel's point. And like Aisha said, I ain't advocating for no programs, but I want to know who are the people in this building? How were they identified as being able to move like be able to use this space to best utilize the space to move a public agenda forward. But I would like to know all of this. And I think it's extremely disrespectful that we're seeing the workers and not the people leading this agenda.
Thank you, Domingo. I had Glennis next.
Thanks, Ariel. So to address some of the things that have been said, a lot of the information is outdated, right? So if we're talking about information from 2010, 2005, 2004, you know, I think it's really important to look at the past, evaluate it for sure, but then move forward, right? In a very clear and intentional way. I'd like to state for the record, Maria Luna is on this call. She's on the Zoom and she's a board member of the Armory Foundation. I'd also like to state that I am, you know, Domingo, I know you didn't mean any disrespect, but, you know, I'm upper management at the Armory Foundation. I'm the chief administrative officer there. So I wasn't sent in to be the face of anything. You know, I hold a position for over 10 years at the organization. So, you know, I wouldn't just brush off that me and Alberto, who's a director at the organization, are just kind of putting up a front or anything like that. So, you know, we have, again, at the Armory, the committee meeting in 2019, we provided a letter from DHS to the committee stating that the Armory Foundation is in full compliance of his license. You know, I'm not sure if that wasn't sufficient for the committee. If they needed an updated letter, we're happy to work with DHS on that. But again, we provided a letter that said we were in full compliance of our license. And this was in 2019. Now, remember, like Leilani said earlier, 2020 is kind of a blur and a lot kind of got stuck in the mud that year in terms of things moving forward and, you know, organizations working how they usually work. But we're happy to work and collaborate with this committee. You know, we've invited you, the Armory Foundation has invited the committee several times, you know, open invitation, open door, come in, come see what we're doing. Let's talk, let's figure this out. Let's collaborate, let's work together. You know, and to date, we haven't heard from anyone outside of this meeting and the one in January 2019. There have been no one has come to meet with us. No one has come to try and have a tour, nothing. You want to see the spaces being used? That's absolutely fine. Absolutely fine. We're more than happy to give a tour, whatever you need. But I think we all need to be on the same page for sure. And that's the way that we can move forward together.
Ariel, I would like to ask a question then. So could Maria Luna please speak to what the agenda is for the board? And like, because it seems pretty like you have a board member here, right? So
okay,
that's
so
who you should be addressing.
I'm gonna keep circling back, but let me just go through. I have Alberto next, and then Maria Luna, and then myself.
A lot to what Glennis has just stated, I wanted to say also. So I'll put my hand down in a second, but I do want to reiterate that I specifically have been coming to community board meetings in the past frequently to share a lot of what we're doing, what our direction is, what our commitment is to the community. And we are not doing this alone. We are always looking for help. We're always looking for different ways to get people to support us because we have an awesome job. There's, I think, over 80,000 children in the community that we're trying to get in the building to work with us in some capacity. I've stated a few minutes ago that we have kids in the building frequently. Right now, we're running what's called a learning lab, which is an opportunity for essential workers to have their kids come to the Armory and do their remote learning.
Isidro, I think that you're creating feedback. I don't know if you know you're on two cameras.
I'm not on two cameras. No,
Isidro.
Oh, okay. But again, maybe this is not the right time. As Aisha said, this is not so much about programming, it sounds like, but we have heard a little bit of misinformation going around about things that we are doing and not doing, kids that we are serving and not serving. If the situation is that you don't know and you want to hear, I've tried to share a few times at different meetings. Our website is updated. However, I do understand that sometimes it's better to hear straight from a source. So again, I encourage everybody, if you'd like to come in and talk more about specific programming, I give us an awesome tour of the building and we have a really robust program. So again, just wanted to reiterate that.
Aria, just quickly, I don't want to interfere in how the committee is flowing, but you know, the seriousness of the Armory pending.
Can we hold until we get to you?
Sure.
I want to hear from you. Don't worry. Just want to make sure. All right. So Alberto, sorry, that was what you're going to mention, right? Okay, perfect. Maria Luna.
Hi, thank you. I'm going to be very brief. I have a problem in my throat. Anyway, I've been a member of the Armory board since started over 30 years. I've been a member of this community board for 36 years. I have seen the Armory grow. I have seen the benefits of the Armory in our community. I have seen the work that we have done, the same work that our community board also does. It's very unfair to have every time that we hear, sorry, resolutions coming and going and questioning and pointing fingers without giving the Armory or the city. When someone says, this is our community, this is our place, this is the city, we don't displace anybody. The city have taken their rights to ask for someone not to longer use the Armory as a tenant. It wasn't the Armory board. Of course, there are some questions about this organization that everybody is praising highly. And if we're going to start pointing finger at our question, we should be doing the same thing for every person or every entity that is linked to this resolution. As a board member, I urge all of you to come to the Armory. Now, if you think that we are going as board members of the Armory are going to sit here in judgment, you don't do that to Coca-Cola, you don't do that to Citicorp, you don't do that even if we buy Coca-Cola and if we have an account in Citibank. So I think we have to move on. Now, if you want a specific thing, we are ready, as Glennis has said, we are open, we are very transparent, made mistakes before, doesn't mean that we are actually doing anything wrong. Armory is beautiful. Today we service 5,000 people came to the Armory to have their vaccine done. It's a work between the Presbyterian Hospital and the Armory. The community has a benefit of what we had there. Now, the only thing that I urge all of you, instead of discussing how these resolutions are coming back and questions this and that, start from the city, and then we can move forward. That's the only thing I can say. I am a person that gives the opportunity to both sides to air and to vent whatever problem they have openly, but I'm thinking that if you take a look at the record of the Armory for the last few years, we will all be very proud. As far as the education system is concerned and the George Washington High School, that is mainly a baseball, place. Dominicans love baseball. We love politics, we love baseball. So they are taking advantage of the opportunities at the Armory. So how many more high schools have the track? And as Alberto said, he has spent a lot of time reaching out to all the schools, from the middle schools to the high school, to participate at the Armory. That's the only thing that I can say right now before I ask my sister to bring me some water to drink. Anyway, thank you so much. But I am a board member. I will continue to be on the board until they throw me out, but I don't think they're going to do that. But anyway, I inviting all of you. We all have responsibility, elected officials, and we can show you what now they have turned around and support the Armory full force, because we are doing a fantastic work. Some of you are very new. I see faces here that I haven't seen in a long time. New board members that are not familiar with what we have done at the Armory. And it's unfair that a 23 points bullet point. I'm sorry, I'm a board member of the Armory and a board member here. I'm not gonna take that much time. I'm just saying that someone said, what happened? How come they didn't send anybody? They didn't send me. I like to participate because I'm a member of the community board.
Let's pause. You're past 2 minutes.
I'm sorry.
Okay. So I'll just spend my time asking questions specific for DHS. In relation to the license, does DHS know the exact language that is within the current license last signed or still active with the Armory Foundation?
I
Does
can give
DHS?
I'm sorry.
Oh, no, it's okay. Does DHS know whether or not the current actions or even past actions have been in line with the very text of the license agreement? I'll also ask, has any corporate or social events that have specifically taken part in that building been in line with the text of that licensing agreement? Is the Armory Foundation allowed to specifically charge for the usage of space in areas that are outside of that purview specifically mentioned in the text of that license? And just to mention, I know I'm asking a lot of questions, but this will definitely come back at some point. Does DHS do their own finance and auditing for this Army Foundation, the entire building, or does it allow for the Army Foundation to do that themselves? Does DHS also conduct their own investigation of Army Foundation's books to see how they are utilizing the money? Does DHS know that they were required by the charter to be submitting reports to the community board for years? They're highlighting many of these elements. Has DHS submitted those reports to us?
I have a question about that piece. When you say that we are obligated to sit in or send a representative to the community board, because we have a shelter operator that operates within the Fort Washington Armory that sits on the district service cab every month. I participate in the district service cab every month. Is this exclusively, specifically speaking to a representative of Fort Washington Armory? Or in the charter, what you see is saying that DHS is supposed to, because that's new news to me. I mean, I do sit every month at the district service cabinet meeting. However, don't report out on activities occurring in the Armory. So that's new news to me. But I do know that the Armory also has sat in and participated in the district service cabinet meetings for Community Board 12 as well. I would have to get back to you, or I would like to see what the language is in that charter, because I've never, that's something I'm not privy to or aware about. But I do personally sit in every single month as we are mandated as an agency to report out at the district service cabinet meetings monthly with Community Board 12. What happens is, if there's any questions or, pressing burning issues for the agency, that's an opportunity for us to capture that and circle back and answer to the community board those questions. So it hasn't come up at district service cabinet meetings, questions or concerns about the Armory. But, also happy to use that as an avenue to correspond to the board as well.
Yeah, thank you. And just to note, specifically referring to the reporting that's required by the charter.
What, I'm sorry, because it's a little muffled, but what section was that in the charter?
Yeah, so this is pretty much going through chapter 69 and 70.
All right. And Ariel, you're gonna send me these questions, right? At the end?
Yes.
Thank you.
All right, so I'll just also ask one last thing. With regards to the contracts that are entered into to use the space at the Armory at the Fort Washington Avenue Armory by the Armory Foundation, do those get reviewed by DHS?
I would have to circle back and get you answers to these questions.
Okay. And in regards to when it's also applying for grants, do those also get reviewed by DHS?
I don't have the answers to these questions. I'd have to circle back and get you a response to these questions.
Gotcha.
These are all legal. Our legal department, who would have oversight, would they be able to best answer these questions? But we can provide responses. We just need to get these questions submitted to us in writing.
Gotcha. And this is more going beside everything the legal. Does DHS also observe how much the staff is being paid for the operations of the Fort Washington Avenue Armory?
Yeah, these are all governance. Everything relates, as it relates to the governance piece, falls under the legal department of the Department of Homeless Services, who can best answer these questions. So I would, again, would prefer to get these questions to us in writing. And I will do my due diligence and ensure that we circle back to you all with responses and answers to these questions.
Okay, thank you so much, Leilani.
Mm-hmm.
All right, so after, I think Isidro is next, and I think Isidro just hopped out. Am I seeing Isidro? No, I'm not. Okay.
I stepped out for a while, Ariel. I think you addressed my concerns. Thank you so much.
Okay, thank you, Isidro. Okay, so I believe next was Angel, or was it?
You I'm good, thank you. My questions have been covered.
Okay, Aisha, and then I got you, don't worry, Domingo.
I just wanted to comment on something that we learned in our research is that the Comptroller's Office has an audit responsibility where the building is concerned. We did find a copy of one such audit, if I remember correctly. I spoke to the Comptroller's Office in the last week and asked about that due to the fact that there is a pending lawsuit specific to the taxes that the Armory may or may not have paid on the revenue that was brought in via the rentals that they were not supposed to be doing. The Comptroller's Office was not at liberty to comment in any way on that, which is the rule in effect for, I believe, the Comptroller's Office. They don't comment on things where there's an active lawsuit happening. So I just wanted to put that forward.
Thank you. Domingo. And then I see you also as well. Maria, you have your hand raised.
Yeah, I just want to be able to ask Ariel for if it's possible. Glennis is here. You got a board member with Maria Luna. If it's possible to get like a sort of like impact report, just to see the breakdowns of Armory programming, but within its entirety, not just sub-programs, but the Armory programming's entirety, and just breaking down the compositions and stuff like that. I think that would be a valid question to be able to identify space usage and where the lapses lie.
So I forgot the second half of what I was going to say, so if you will allow. I think that's a perfect point, Domingo, but what I want to remind everybody, right, there's a resolution that has already been drafted. The claim that is being made right now and what is being spoken to is, as has happened in the past, this idea that this is an attack on the Armory Foundation as an organization and their programming. That is not what this is about. And it's not about what has been done, that they've changed their policies in the last 4 years or how they execute their programming. It is about the fact that if we all agree that before the last 4 years, there were some problems that took place, what has changed from the city agency that governs this building to prevent that from ever happening again? And from what I can tell, nothing. First of all, they're not able to produce the answers. We haven't, this is since March of 2019. We asked 23 questions and we still don't even know if we have the answers yet. But they're not here available in the meeting. They were forwarded, they were re-forwarded and re-forwarded. This has been a hot topic for quite some time on this board. This is about preventing some of the malfeasance that has already taken place from ever happening again. But it's not only about this license. It's not only about whether they're even in compliance. I would say that they're not in compliance, especially if they're renting the venue, which we have discovered in this meeting that is the case. But this is about how this building could be best serving our community. Period. And
yeah,
if
Aisha,
it's not
that's
appropriate
Aisha,
information, then I would put forward that the resolution that we
Aisha.
put forward. I'm sorry.
Domingo,
Yeah,
let's just let
wait,
Aisha finish that
because
thought.
she had a point that if programming is what folks got out of it, I'm interested in just knowing, because that's what's going to give us.
This is not against your point, Domingo. This was not against your point.
Okay, yeah, because the usage. I'm interested in the usage of the space.
Domingo, let's just let Aisha finish, and then we'll come back. Okay.
So those are questions that I certainly have raised, especially when I was sharing those meetings. We asked those questions. And to begin with, beginning in 2014, the reason a lot of these changes that can be spoken about in this meeting happened at all was due to the pressure that I began to put on the Armory, pretty much myself as a board member. And then in conjunction with GDS and other community members that all participated in coming to our meetings. Our meetings, the time that people were allowed to speak was changed from 3 minutes to 2 minutes. And the previous chair told me it's because they were tired of hearing the community members come to ask what's going on with the Armory. Okay, so I completely respect the questions about how we can have programming that serves the community to the best of our capability. That's what this conversation definitely is about. However, it's about the building, the contract, the license that's in effect, and whether the policies and procedures in place ensure the deliverance of what the license currently says or what it could possibly be saying, so that we don't end up in this situation again. And I feel that the 4-page resolution that was drafted by the current chair of Housing and Human Services definitely speaks to what the need is. Drill down, read that resolution.
Aisha, time.
If any questions, anybody is free to contact me personally with my knowledge over 7 years about what has been happening with this, as well as the Armory Foundation and anyone else.
That's respectful. Okay, Domingo, I want to give you back your time.
Yeah, because I was just interested in, and I'm trying to figure out, like, because it's always so, like, I just want to be able to, you see how certain organizations have breakdown of space usage. So it's like, okay, X amount was done for this, X amount was done for programming. This is the racial breakdown for programming. Like, I'm interested in, because since we have a board member here, she could take that back to the board and really discuss and provide this information, being that this isn't public space. This is a public space. I think there's a certain.
We didn't have it at the time.
Yeah, unlike Coca-Cola, unlike all these other corporations, this is public land. This is not tax credits. This is not. Yeah, so it's yeah. Thank you.
Yeah, thank you, Domingo. And with that, I'll actually just note that, going back 2 years now, we've asked for that kind of breakdown. That last meeting back in 2019, that was a specific ask. That was a specific item that at that time, the Armory Foundation had said they would provide, and that has not come. So, I would also point and say to then DHS, if DHS is also trying to track that sort of information, so as to who exactly is receiving services in that building, are they from the community? What percentage is perhaps specifically coming from individual schools? That kind of information, I think, is very critical for us to also make a determination as to how that space is being utilized. And so I would ask that, that can also perhaps be provided in that sort of statement that could come from the agency.
Okay. Yeah, most certainly, and always to be helpful with, and responsive with any questions, burning questions or concerns. Please always email them to me. I do want to say, because we've had a lot of dialogues and meetings around this, that the Armory, the elected officials, I do recall, and forgive me that I can't quote things verbatimly because it was a while ago, but I do know that the Armory did present a lot of this information regarding the in and out, the activity, the programming that they offer. Gail Brewer was a part of that conversation, Congressman Espaillat office, Councilman Bidanis. There's a lot of players involved in this, and I think it's just a matter of us doing some more digging and pulling out information and the conversations and emails, correspondence of what happened, catch everyone up to speed on what follow-up is needed. A lot of information did live with the former chair. And so, I just want to, be helpful. And again, I came tonight because I thought it would be good to listen to hear what the community had to say, although I knew folks would be frustrated that there wasn't any agency responses that I could provide tonight. But I think this is just good for community engagement purposes and community relationship building purposes of us being present tonight to hear the community out. I'm sorry.
We had 2 other meetings that DHS didn't show up to.
I don't really want to get into the back and forth about that meeting because there's a number of reasons why we didn't show up for that meeting, and solely had to do with the way it was communicated about when that meeting was scheduled. I don't really want to revisit the past. We're here now. I'm looking forward to continue to work with the community board. I really want to work with this committee. I really want to work with Community Board 12. Always have. I'm very willing. Ariel, you know me. The district manager knows me very well. This is why I showed up tonight, knowing that there was an expectation for responses that we wouldn't be able to provide tonight. However, this is an opportunity for me to hear everyone out and circle back to senior leadership to get answers and responses. So I look forward to hear and to receive those questions to me in writing so that we can circle back to answer and address everyone's questions and concerns.
I just want to quickly remind the chair, this is also the community's meeting. And so there's people that have been commenting that may want the opportunity to actually speak. So I don't know how you want to, but okay, this is the community's meeting, so.
Okay, so I'll let now Glennis be the last. And then let's see, I'll switch over and just check for attendees. See if maybe we can get some questions here.
Thanks, Ariel. I just wanted to reiterate and remind everyone here that the Armory is 100% open to disclosing any information that you'd like us to provide. Ariel, if you want to shoot me an email with any questions, concerns that you have, we are happy to share and collaborate any information. It would have been great if that email with questions and concerns had gone out before this was drafted. We haven't heard from this committee since January 2019. And I just want to be clear that we are open to collaborate. We are open to work with this committee, with the community board, with the elected officials, with DHS, with DSS, with all of the agencies and all the organizations to provide services. This is about our programming. What the Armory does within those 4 walls, is what we do, right? It's the essence of what we do. It's the reason we're there. So our programming is tied to what happens inside of that building. So I wanna just be clear with everyone that the door is open. My phone number is available and my email is available to everyone. If you have a question for me, feel free to shoot it in the Q&A or the chat. I'm happy to answer anything. And if anyone wants to keep going with this discussion, we're happy to have it at any moment.
Okay, thank you. So if I can just now ask from the attendees, If you have the function to I guess, raise your hand, please just let me know. I believe you should.
Do they have to be elevated?
I should be able to allow them to talk. I'm trying to see if maybe they can raise their hand. Okay, yeah. Okay. Phil, are you able to? Perfect.
I hit unmute. Can you folks hear me okay?
Yes. Perfect. Thank you.
Okay, good. Yeah, my question is for Ms. Irvin. It's actually a three-part question. Part A is why was GDS evicted from the Armory? Part B would be is what is the space that GDS was using at the Armory? What is it being used for now? And the last part is DHS looking to reinstate GDS in the Armory?
Hi, Phil. Nice to hear from you. I unfortunately don't have, wasn't prepared tonight to come to talk about GDS. I would have to get back to Community Board 12 or you to respond to that question.
If you could get back to the community board, because it's not only I that has that question, numerous folks within the community do. So if you can get back to the committee, it'd be appreciated. Thank you.
You're welcome.
Okay. Oh, sorry. Technology. Okay. And I'm so sorry. Did any other members from the public also have questions that they wanted to raise? You can just raise your hand now.
If everyone could just mute themselves, there's a feedback going on that's creating like a glitchy sound.
Gotcha. Okay. I think it should be coming. Are you able to speak, Dr. Gary? Dr. Gary, are you there?
Hello. Hi.
Hi.
Can you hear me now? It's unstable.
Yeah, perfect. Thank you.
So how about now? Can you hear me now?
Yep, we got you.
Hello. Good evening, everyone. Hi, Liliani. Nice to see you. I wish you could see me. So we met on March 7th, 2018. Do you recall that? Yes. And at that time, we shared with you the license. We shared with you the video of GDS and the importance of the mental health services. Do you recall that?
Yes.
Okay, and we shared with you that Jack Pfeiffer is sleeping in the building for a number of years. Do you recall that?
That wasn't verifiable, but I recall the conversation.
It wasn't verifiable?
Correct.
Shortly thereafter, he seemed to leave. So it's it was kind of the next year on March 7th, 2019. Yeah, that's Jack's room. I had a picture of it. That's part of the retaliation, which I think you're very well aware that GDS was retaliated against. Why were they evicted? So let me just make something very clear. The four walls of the New York City Fort Washington Armory is that owned by the Armory Foundation? Does the Armory Foundation control all four walls? Do you know that, Liliani?
Yeah, so as I expressed earlier, these are answers I don't have and would need to get back to this committee. Would prefer these questions to come from the committee to me in writing with all of these spelled out detailed questions so that we can provide responses. We've received several incoming questions. Community Board 12.
Take back my time.
Sure.
You promised in video, which we could be glad to show you with Matt Borden, you promised that you would look at the whole building. You promised that you would help GDS relocate, or and you made promises that you would let us be offered the RFQ, the request for quotient. Has there been an RFQ offered for the space, for GDS space? Okay, I'm asking Community Board 12 to take a tour of GDS's 1,200 square feet, which we actually use private money to build out since 2002. And also for the record, we are asking to, our mental health services are essential, and we were wrongfully evicted when you have 1199 in Jack Pfeiffer's room. So why did 1199, who is not helping the community, you have spaces in there that are not helping the community? Every space in that building is supposed to be for the community.
I hear that. Again, I didn't come prepared tonight to talk about the exit of your organization. I myself, Gary, as you know, we've had several conversations, Gary. We've had several conversations with your organization, and I rather, you know, I again came tonight not prepared to talk about the exit of GDS. So I unfortunately don't have the answers to your questions.
Wrongfully
we'll work with Community Board 12.
Foundation. The Armory Foundation tried to evict us 3 times. They overcharged us, calling it rent, not a fee. And you're aware of that. They had to pay us back $50,000 and in credit. And you are aware of all of this.
I'm not actually. So I just confirmed what I'm aware of and what I'm not aware of, Gary. And
I'll send you the
Dr. Gary.
Okay.
And again, I'm open to continue to work with the Community Board.
This is exactly the mirrors I warned at the general meeting that this meeting would become. We've done this before.
Let me just ask, just so I'm being fair to the public. Are there any other members that also want to say anything at this point? Any questions that they also might have had for DHS or Armory Foundation? Okay, I'm seeing Nathan. Nathan, are you there?
Hello, can you hear me okay?
Yeah, you sound good.
Can you hear me? Okay, perfect. Hi, I'm Nathan Walkley, just a member of the community, and I am a volunteer for social justice advocacy at GDS. And I was just wondering, I guess this is a question for the Armory Foundation and DHS as a whole. Why is it that a lot of the systems of education within the building were restricted entirely to people that were only taking track? The building is funded by the state, so its resources should be available to everybody. And the percentage of students who run track within the community is obviously much less genuinely needed. That's it. Thank you.
Okay. All right. Is there any other members from the public? If not, completely fine. Just wanted to ask. Okay. So I guess I'm gonna give folks some, because I'm seeing hands again coming back up, but I'm gonna give a few. Let's just put down 7 more, and then we can call this to an end for this individual section. Okay. All right. Glennis, yes. And I'm sorry, I am going between different technology here, so please.
No problem. I'll make this quick. I just wanted to answer Nathan's question very quickly. He asked that all people who participate in our educational program have to be a track athlete. That is not the case. We accept anyone from the neighborhood, and neighborhood, I mean Washington Heights, Inwood, and Harlem, who wants to come and join our programming, be it educational or track, and we encompass both aspects into that child's activity and programming with the Armory. So you do not have to be on a track team. You do not have to be a track athlete. We take the kids in and we put them and incorporate them into our athletic and educational programming to provide, wraparound services for everybody. And Alberto, if you wanted to say anything else on that, since, you lead that.
Ariel, is that okay?
If you're gonna switch over, just to go through with everything going on here. Mariel, let's have you go first, and then Alberto will switch on over. Okay.
Yep. Thanks, Ariel. Glennis, just for the record, if you can just again kind of clarify who you're referring to when you say we.
Certainly, the Armory Foundation.
Thanks.
Okay.
Can I jump in?
Yeah, Alberto.
So I work directly with our, our high school department, and I lead the middle school department. We have lots of kids come in, and we always try to work with every child who comes in from the neighborhood. Specifically, our program design is very holistic. We invest a lot of time and resources to supporting a child to get into college. But it's beyond that also. It's taking students to take control of any goals that they set. The working with children is very comprehensive. It's holistic. We work with their families very closely. We work with the students and even their schools very closely. So I think that there's a misconception that we are just taking in track kids. We're taking in kids and we're offering them a holistic, massive service. And again, very happy to go in detail about what we're doing specifically if anybody has questions, but we're not saying no to anybody at the door.
Thank you, Alberto.
Thank you.
Okay, sorry, Aisha.
I just want to put forward as a point of, I always say the wrong thing, but information about the fact that this board actually did participate in a tour previously, and it was actually at the inception of the programming that Alberto and Glennis are speaking of. At that time, it was really like a sham tour. We did not see the entire building. We only saw what they wanted us to see. And in fact, there was a presentation being done in the theater where I recognized I've run a youth program before. So it was weird to see mixed ages, high school down to very young kids, less than like 15 kids, and saying, here's our program for middle schoolers. And then I recognized some of the kids, and afterwards I had gone down to PAL to ask the director there. And while I'm talking to the director, I asked, did you have kids upstairs? She said, yeah, they asked if they could borrow our kids. They were upstairs in the theater. And while I'm talking to her, here come those same kids down to PAL. So we had a tour. It wasn't a very good, and you could talk to the former chair, George Fernandez. He was on that tour. He should remember that. So there has been an effort, and there have been changes. I'm not saying that there haven't been changes, and the changes are welcome. We need changes, but what we need more than anything is the overarching governance, which is supposed to be the Department of Homeless Services, that ensures that the building is operating at all times to the best possible for our community, the entire building, not just the carve-out space which belongs to the Armory Foundation, which is not the whole building, the entire building.
Thank you, Aisha. Alberto.
So Aisha, I'm so sorry that you had a negative experience with the tour. I don't remember when that happened. So if you were seeing the middle school program, which I lead, and I'm the lead instructor in the classroom, I recruit every single child. I talk to every single parent. I don't remember, but if you say it happened, I apologize that you had that experience.
You literally just started at that time.
5 years ago.
It may have been your first week, to be honest with you.
Aisha, let's just let him finish.
You know, Aisha, I was the first person who started the program. Anyways, middle school has kids all the way from 10 years old to 14 years old. So if you thought that it was a mixed group, you could ask. Those are questions that we're transparent about. We're very clear about. But also, we do have partners.
Director of PAL, and she confided that some of the kids were her kids that were borrowed. So I did ask.
As I said, the PAL is an organization that we have worked with historically. We collaborate with other nonprofits in the neighborhood. We work with other charter schools. We work with other public schools. We are working very closely with other groups to deliver high quality programming. So we have had schools like Harbor Heights, send us over 100 kids regularly. We work with the Y Foundation. We work with the FYI. We work with Children's Aid Society. We have a number of organizations. And again, I'm sorry that you jumped to that conclusion that it was something that we were trying to show you that wasn't true to the reality.
I don't think I jumped to a conclusion. I'm telling you what my experience was.
And I'm trying to give clarity as to what we do at the organization. We are, I think we're running a very clean and good.
My son has participated in city, what was it called? City Sports for Kids?
Sure, let's just
participated in that. It was a great experience. That's not what this conversation is about.
Okay, but he has 16 seconds. Let's let him finish.
Just for everybody who's in the group, again, I'm always willing to answer questions about the program and the quality. We're really proud of the program that we've offered, and we deliver something that I think that is a meaningful experience to the kids there. Thank you.
All righty. Well, Aisha, did you want to take the next one, or is I think that good at this point?
No, I
Isidro has his hand
my
up.
bottom line is about the overall governance of the entire building and what is happening at all times, which is not strange. As Ariel has stated in previous meetings, there's a way in which these types of buildings are run. This is not it. Unfortunately for the community, this is not what it looks like in most other communities as far as how it can be more effectively maximizing on the square footage. What is the number? Over 200,000 square feet. It's not entirely serving the community the way that it could be. And that's what we want to change.
Okay, thank you. All right, Isidro, you are the luckiest person in the world. You take the last one.
Thank you so much, Ariel. I just wanted to see if either Alberto or Glenis can share some lights as to how the process was approved by the foundation for someone to go and apply for a liquor license, and how that went about, who was involved. And, I want to see some clarity into this, because it seems like it was not answered when I brought up the question or the issue. If either one of you can, share lights on that, that'd be really helpful.
Okay. Do you want to just respond to that? I think this is it.
Sure. So the Armory did not authorize the caterer at the time to go and apply for a liquor license. And they did not have the authority of management to do that. And they are no longer the caterer at the Armory.
Thank you, Glenis.
No problem.
Point of information, that's not what they said at that meeting. So
Okay. So this will be it. With that, I just want to say thank you, Leilani. You have been with us for the past 3 hours now. I want to thank you again so much. Alberto and Glenis, thanks for joining us. And with that, I will go ahead and switch on over to new business. If there is any new business, please, committee members, feel free to include it here. Isidro, are you still raising your hand for the previous question, or is this for new business?
I'm sorry, I'm going to lower my hands. Thank you, Ariel.
No worries. Okay. So seeing no hands, and I'm also checking. Okay, no hands for new business. I will just mention old business. Anything at all? Okay. So with that being said, I will go ahead and ask to have the meeting closed. Can I get a second?
Second.
Thank you all. All right. Have a great night, everyone. Take
Thank
care.
you for having us.
Thank you. Have a good one.
night, everybody.
Good night.
I know.